Bovine tuberculosis is a state-controlled disease. The state veterinarian enforces the control measures. The control is done by the so-called test and slaughter scheme. That means all animals in the herd are tested using the tuberculin skin test. If there are any test-positive animals found, the entire herd is placed under quarantine. All test-positive animals are branded with a T on the left side of the neck, and either all T-branded animals are immediately sent for slaughter, or in some cases it can be agreed to do a test slaughter. So the oldest and least valuable test-positive animal is sent for slaughter to evaluate the carcass at meat inspection. But if any positive indication for bovine TB is found, all test-positive animals must be sent for slaughter as soon as possible. With bovine TB being a very chronic disease, the eradication cannot be complete after the first round of testing and slaughter. But the entire herd must be retested after 3 months, again using the tuberculin skin test, and any positive animals are branded and slaughtered. Why 3 months? It appears to be a very long time. This refers to the sensitization of the animals caused by the injection of the tuberculin during the test. So a waiting period is required before the next test can be performed. The quarantine can only be lifted after the entire herd, that means all animals above the age of 12 months, had 2 consecutive negative skin tests. That means the complete period up and until eradication is complete can take many months, sometimes even years, and cost the farmer a lot of financial losses. Once the quarantine is lifted, the herd still needs to be retested at least once per year for 5 years. The National Bovine TB Control Scheme is experiencing an increasing number of constraints over the past years. And the main reason for it is that this TB control scheme has been designed by European countries for European conditions, meaning it is a very cost and capacity-intensive control scheme, which is affordable to European countries and who have applied it very, very successfully. But this control scheme is less and less affordable to South Africa and other developing countries. One of the constraints we experience is the lack of appropriate compensation of farmers for animals that test positive and have to be slaughtered. As a consequence, farmers show poor compliance with the testing scheme and try to get rid of test-positive animals instead of having them slaughtered. It also leads to a poor enforcement of the control scheme, because farmers with test-positive cattle cannot be forced right away to have these animals slaughtered. For example, in the case of a test-positive pregnant cow, the farmer should be allowed to wait until the calf is born and can be salvaged before the cow is slaughtered. That leads to the danger that these positive animals stay in the herd and infect other animals. The poor enforcement also leads to longer inter-testing intervals. We see that herds that are due for testing, for example, every 2 years or every year, may not be tested according to the scheme, but the intervals may extend to many years due to a lack of capacity in veterinary services. As mentioned, the tuberculin skin test is a subjective test which requires a high level of experience and testing skills. And unfortunately, we see a gradual erosion of these skills in the country. Sensitivity of the skin test is obviously not 100%, as there is no biological test with an absolute sensitivity of 100%. That means a certain number of animals always escapes testing in a test round. But if the next test is done in a year's time, these animals will probably be picked up and be removed. But if the intertesting intervals are long, these animals may not be picked up in time and contribute to the development of anergic reactors, which are test positive but can no longer be detected neither by the skin test nor by the interferon gamma assay. But such animals are usually in the advanced stages of bovine TB with very severe lesions, and these animals are very often severe shedders, infecting many other animals. And lastly, with the presence of tuberculosis in wildlife, there is always a risk that infected wildlife reservoirs in the neighborhood can lead to spillover of bovine TB from wildlife to cattle, causing additional losses. And we have published these constraints recently in a paper in the OP journal, which can be accessed openly.